Hi guys.
Hi there, it's Lisa and Britt
Hello.
from Errol Street Chiro. And we have a fabulous month for you guys. We are myth busting.
We are.
So what that means is that we're going to be chatting to you about
Pull this up. Sorry guys.
the different questions that people may ask, but also
Yes.
the questions that people maybe don't ask because they don't really know who to ask, and there's a lot of stuff about safety and about children and about, you know, are we real doctors, about research, science, a whole bunch of stuff we're going to chat to you guys about this month. So this week we're talking about chiropractic and how safe it is for you to get an adjustment. So I've been a chiropractor for 30 years. This is my 30th year in chiropractic, and giving care. So there's a lot of years
That's
there.
a lot of years.
Britt's been a chiropractor now for several years.
Yeah.
And I can quite happily say, in terms of my experience, in what I've seen in my offices over those years, is that I have not seen any adverse reactions.
Yeah. And also
any
as
serious
somebody who's been a
reactions.
patient for a very long time before coming a chiropractor as well. Yeah.
So, you know, we really don't go into this profession other than to help people. So, you know, and obviously, and we will be going through this later on this week. We're going to have a chat to you about the level of education that we do have. So, Australian Chiropractic Association is our main association.
Yeah.
And about 4 years ago, they did put out a media release and made a statement really about the safety of chiropractic. So, someone has joined us. Hello, Lorraine.
Hello. Hello, Nana.
It's chiropractic, Britt's Nana. So, the Australian Chiropractic Association, this is just quoting, they said that chiropractic care is a low-risk modality of healthcare. There have been a few, if any, serious side events or adverse reactions reported in medical literature in the past 20 years, despite utilisation rates of chiropractors increasing significantly in that time. So more and more people are seeing chiropractors. In fact, there's about 12 million chiropractic visits per year, and there's a lot of visits.
And that's
isn't
just
it?
that's just in Australia.
That's in Australia. You know, people do hear a lot of negative stuff out there about chiropractors, and you know, I appreciate people actually being open and letting us know what they've heard, because then we have a chance to have a real chat and heart-to-heart chat about the research, about our level of education, and you know, the different boards, and you know, the World Health Organization in their guidelines for chiropractic care and safety worldwide, again, will have said that chiropractic, you know, is a safe modality as long as we're using it properly.
Yes.
So the World Health Organization, our Chiropractic Association, have, you know, both quite happy with that safety level.
Yeah.
And AHPRA is our regulatory board.
Yeah.
AHPRA is not just chiropractors' regulatory board,
all
but it's
allied health professionals.
all. So that includes what, Britt? Includes
psychologists, osteopaths, physiotherapists,
medical
doctors,
surgeons, nurses, all of these people that are your primary contact.
Yeah, and we are classed as a primary healthcare practitioner.
So AHPRA is that regulatory board that we all fall under. And now, really, it kind of says something, that the fact that we are in or under AHPRA is that there is a certain level of trust in what we do as health professionals, and because we've obviously meeting a certain high level of standard in education. So, and the interesting thing, I was just looking at some stats there, that there is a very low number or percentage of chiropractors that have been a complaint put against them. And it is extremely low. But the big question is what? When people are thinking about undertaking chiropractic care, is the question around adjustments in the neck.
Yes, and can it cause strokes or other health issues from having your neck adjusted as well? Yeah.
Don't adjust my neck.
Yeah, there's a lot of fear around it, and it's also because there's not a lot of, well, you know, people don't have the right information when it comes to it as well.
Yeah, definitely. So you know, if someone hasn't been to a chiropractor, they're not necessarily going to advocate you going to a chiropractor because they haven't, like you said before, they haven't had that experience. But what we find is that people that are under chiropractic care really do have that high level of satisfaction with their care. So strokes, let's just put it out there. I've actually did a video a little while ago, and the research says that there is actually no causation of the chiropractic adjustment causing a stroke. Nothing, zero, nothing in the research that shows that that neck adjustment will cause a stroke. So that is great, guys. But the thing that I really want to stress to you is that knowing that is great, but we still do what we do normally anyway, and that is really assess that person individually. Yeah, and they have a thorough assessment and diagnosis before any adjustment or any management plan is done, and that then allows us to work out the best course of way of treating the patient. Yeah. And we get x-rays done if we need to. Things that we take into consideration. It's really important for you to just kind of get a little snippet of what goes through our head when we are looking and assessing people to see if they are right for chiropractic care, because sometimes people we can't adjust them. No, and we know for health reasons. And I think we also know how to assess and make sure we are. Then, if we can't help them, we're referring them to the appropriate practitioner as well, which is a very important skill in itself. Yes. So what I remember learning very early on when I came out was it's not so much important when to adjust. It's you're a good practitioner when you know when not to adjust. Yeah, definitely. Okay. So things that we take into consideration, obviously, people's age, their level of health. Yeah, previous health history as well. Totally, if there's any kind of cancers there or any old fractures as well, blood pressure. Yeah, that's right. Their general health status. We make all those kind of questions. We, make sure we know and understand what's going on with that person. Yeah. A whole bunch of things that we need to really find out before we do any kind of care on that person, because at the end of the day, yes, we are here to help, but we definitely don't want to be aggravating that person along the way. Now, what people do sometimes find though, Britt, and this is really important, and we really make sure we do this in the office, is explain to people that after an adjustment, if they haven't been adjusted before or if they haven't been adjusted for quite a while, is that because the spine and joints can be quite stark and subluxated, then that force and that gentle enough force into the joint can create a little bit of inflammation and that little bit of pain. So, we make sure that we equip everyone with that understanding and that, with that likelihood that you might get a little reaction and what that might feel like. It's kind of like you haven't done an exercise for a while. Your muscles are sore. And, but they always know that they can contact us if they have any issues. And we like to check in sometimes with our patients as well. If it has been a while, or if they're a new patient after their adjustment, we always check in and see how they're tracking as well. Absolutely. We always give them a buzz the next day and just check in, make sure everything's okay. So, guys, I hope today has helped you to have a little bit more of an understanding of, the safety of chiropractic treatment. And that, we are under the, AHPRA, which is the big regulatory board or agency in Australia. And, we look forward to later on this week, Britt's going to have a chat. We're both going to have a chat about our level of education. And then for the rest of the month, we'll chat about different questions that people might have. So... Anyway, it's kind of been a bit serious today. It has, but it is a serious thing, and I think we're done. Thanks for watching, guys. Thank you, guys. Any comments? Yes, comment down below, or you private message us if you want to have a chat about anything further as well. Yeah, beautiful. All right, take care, everyone. Bye for now.